And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And Candace, of course, it's summertime, and our first best doctor can definitely help individuals who suffer from skin cancer.
That's right. It's Dr. Patrick Walsh, and he's a specialist when it comes to Mohs surgery.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
I had started very early in my 20s to get a lot of dental work, crowns, and then in my 30s I realized it wasn't going to last forever, and this created some problems. Not only is it expensive, but it takes your time and it's uncomfortable.
Implant treatment has really been a great technology for patients whose teeth have reached a point where they can't be restored. Teeth that reach that point either have broken off, have decayed, or are just so broken down that we can't use them anymore in the reconstruction process. In those patients who have reached that point, we recommend removal of the teeth and reconstruction with dental implants. Sue had been plagued by a lifetime of dental problems, including decay and tooth loss. She had reached a point where we did not feel comfortable saving any of her natural teeth, so we decided we'd do a reconstruction for her with dental implants.
My friend Kelly is in the dental educational field, so he's very meticulous and precise. So you always go to the person that's best suited to the job. And in this case, it was a prosthodontist. Kelly said this was the only place to do it, and so this is where we did it. And he was right.
Sue was referred by a very close friend of hers who is a dentist here in Dallas. I was honored to get that referral because they had researched her needs and visited many offices before deciding to come here. What they found in their search was that a lot of the other practices were heavy on sales and very light on education. What they liked about my approach was that I simply gave them their options and was able to show them similar cases so they could make their own decision.
Dr. McFadden is very easy to talk to. He can take a joke. He's got a sense of humor. He's serious when he needs to be. He's very thorough, both in the procedures and also letting you know what's going to happen and how he's doing it.
Many times, patients' dental situations have deteriorated to the point where their whole mouth needs to be treated. Many people can't afford that, so we try to stage their treatment in a way that we have good stopping points along the way so they can regroup and plan for the future.
Unfortunately, obesity is an epidemic in our country, but our next best doctor can help. It's bariatric surgeon Dr. Philip Swanson.
I went to my youngest child's school one day for a parent-teacher meeting and was walking up and down the stairs and just exhausted. And I saw my child look back, just like, "Are you okay, Mom?" And so it was a little sad, and so I just wanted to be able to live life, be able to do things with my children and just not go through it just sad and tired and sick every day.
Lakeisha Green came to see me because she was significantly overweight and was having trouble with diabetes and high blood pressure. When I think about people who are overweight, I think about their diabetes and I think about their high blood pressure. And I think about how that shortens their life. And I think about if there's anything that you can do to get rid of those kind of problems, that's how you're really going to help someone out.
You make up in your mind that this is something you've wanted to do for a while. You think about not being sick. You think about how you're going to feel and how you're going to look afterwards. And I just made up in my mind, and I knew it was right for me to just go ahead and do it and not fear it.
There is nothing other than this kind of surgery that will fix diabetes. What it means is you take the stomach, which is an organ about this big, and you create a small stomach by physically dividing the upper portion of the stomach away from the rest of the stomach. You divide the intestines and bring up part of the intestine to that small pouch and then reconnect it farther on down. So you've changed the pathway where food goes through, and the food no longer goes through the very first part of the intestine out from the stomach, that it changes how your body works related to diabetes. That is such a wonderful thing. It impresses me all the time.
I started noticing I'm eating less, I'm weighing less. I could see it in my face, and I could it was just an amazing feeling to just know that in a few months, in a few weeks, I was going to be a different person, not just physically, but emotionally. And it has been great.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I was one of those individuals who've suffered from migraine since about the age of 8. And in 2008, I started to get very strange headaches. They were coming much faster. They were lasting for weeks on end, to the point that I was doing rapid infusions. I had 3 trips to the emergency room. On the 3rd trip, I lost part of my eyesight. So I went to see Dr. Reed. I was honestly a very skeptical person. I had no intention of having anything metal put in my body ever.
She came in like a lot of patients, still with these devastating daily headaches, had been to excellent doctors. Most of our patients have been to excellent doctors, but they're still at their wits' end.
The first time I met with Dr. Reed, we met for 2 hours. We tried a couple of other things first, and then finally he said to me, "Look, Victoria, I think the only thing we can do for you is the neurostimulator." The trial itself was like it all got turned off. I didn't know what pain-free meant until I had that happen, and it was like the clouds cleared. I could think. We went through the procedure. I had the 4-lead stimulator implant.
Right away, she did well. Her headaches came under excellent control, And it's always a joy to have her and her husband come back to the office, just telling me about, you know, she's in class now and she gets to more enjoy, you know, being with her students, taking care of her students. That's what this can do, you know, it gives her life back, and it's been in it for a long time with her.
I would lose my hair, I would lose anything, I would take all the scars again just to get the relief that I've had. Since the surgery, my life is incredible. Incredible in a couple of senses. And I think this is where, you know, the cliche to say is, you know, Dr. Reed saved my life. What I would like to say is Dr. Reed gave me life.
There are three kinds of skin cancer. There's squamous cell carcinoma. That's the kind that occurs in scaly lesions that grow in size, usually in the sun-exposed areas. There's basal cell carcinoma. Those are gray and pearly with sort of heaped up raised borders, usually again in sun-exposed areas. The most important and most dangerous skin cancer is melanoma. That's what occurs in moles. We use the ABCD rule to decide if a mole or skin lesion looks like it's bad. A for asymmetry. If the lesion doesn't look perfectly symmetric, then that's a bad sign. B for border. An irregular border is a bad sign, a regular border is a good sign. C is for color. If a uniform color occurs in a mole, that's good. If there's multiple colors or irregular colors or a change in the color, that's a bad sign. Diameter. 6 millimeters is the magic number. Anything bigger than 6 millimeters is bad, and that's about the size of an eraser. So take good care of your skin. You only have one layer.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Acne and folliculitis are both kind of related conditions in a way because they both involve the hair follicle. So that's where our hairs come out of our skin, and that is an area that can be colonized with bacteria, and then it can lead to an infection. In acne, the way that it develops is a little bit different in most people. It usually starts off with the tiny bits of scaling that occurs in our skin. In acne, it kind of starts plugging up the follicle. It doesn't kind of slough off as normally as it should. And whenever any orifice gets plugged up, and behind that area, you can actually start getting an infection. So there's usually an overproduction of what we call CW. So if there's any question about it, it's never a bad idea to go see a dermatologist, especially if you have mild acne and maybe you've tried one of the topical things that are on TV or over the counter, it's not working. Then you want to go in and see a dermatologist. Acne can lead to scarring, and it's not necessary to get scarring and cosmetic disfigurement. So if you're not getting good response with something you can just buy over the counter, go see somebody because there are other things we can use.
So Jim, have you checked out our website lately?
I have.
Then you know you can find lots of information about all of our fabulous doctors. If you haven't been lately, check it out. It's bestdocsnetwork.com.
And don't forget the magazine out, the Best Docs Network magazine. Check your local listings. Now to our next best doctor. And for those suffering from back pain, I know, Candace, you have suffered back pain in the past.
Yep.
We have the right doctor for you. It is spine surgeon, Dr. Robert Myles.
I began experiencing lower back pain in June of 2010. In my industry as a chiropractor, I didn't seek conservative care until about November of 2010. And at that point, I was so bad that conservative management wasn't going to work for me because I just couldn't relax enough.
One of the pathologies that causes low back pain and leg pain is something called the spondylolisthesis. And what spondylolisthesis means is slipped vertebral body. And what that does is it causes malalignment in the vertebral spine alignment, and it also makes the canal smaller. If you look at this from the top and look at the canal, this is where your nerves go. But if I allow one of the vertebral bodies to slide forward like this, you notice the canal gets smaller, and that actually pinches on the nerves and causes leg pain.
In March of 2011, I guess it was, had surgery with Dr. Myles, took a 5th lumbar disc out. They also went in and supplemented the stability of the lumbar spine with some screws that they put into the vertebrae. Felt wonderful. I was probably 80% better after the surgery.
Jarrett came in with back and leg pain. It was very severe, and because of Jarrett being a chiropractor, he took care of it himself most of the time. So what we did in his situation is we basically opened up the canal. I placed a cage inside the disc and then brought this piece of his spondylolisthesis back into a normal alignment. Then I placed screws in here to hold everything stable, and that allows this to fuse and become a solid joint. And that got rid of his leg pain and got rid of his back pain.
The post-surgical status of me right now is I've never felt as good as I feel. I've always thought of all health professions having a necessary place. Me being in the health field, I put it off too long before I actually sought a more invasive route.
Dr. Armstrong has a very physically demanding job. What we needed to do for him was to achieve pain freedom for him, and we made his back pain history.
The DietMD program is a medically guided weight loss program for long-term sustainable weight loss.
I've had bypass surgery twice and 5 heart attacks and had gained a lot of weight since being about 40. Doctors had wanted me to get it off, my wife wanted me to get it off, my family wanted me to get it off. My blood pressure was elevated, high cholesterol. So I just determined that I had to do something, and this sounded like it would fit my personality, and I was ready to do it.
It starts with a medical, physical, lab work, EKG, making sure that the patient is in fact safe for an aggressive weight loss program.
There's a body bug that I wear all the time. This measures calories and steps. Then you log the calories into the body bug system, and every week you meet with your nurse and we review what I've done. How many calories did I burn? How am I burning them? What did I consume? What my fat percentage is.
Mr. McAtura is a client who entered the program in September of last year, so he's been on the program for about 8 months now. Has lost about 95 pounds, so he is a very good success story for this program.
The support that you get here, the interaction, is another key to the deal. You know you're going to have to check in with somebody, and that's always a motivator, for me anyway, and I think it is for most people. It's been a big help.
Patients notice drops in their blood pressure, diabetic medication, things like that. Many times we can certainly expect a decrease in these medications, if not an elimination altogether.
For my wife in particular, it eases her burden. If she hears my cardiologist say, "Dave, this is great. These numbers are super," where your heart is stable, your cholesterol is from, it was at 79, now it's at 32. We're going to cut back on your cholesterol medication. Those kind of things just make it easier for the entire family and for me to plan for the future. With this diet, I felt good from day one.
Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. Now, for those suffering from allergies, we have a doctor that can help you out. It's Dr. Paul Worrell.
I was having a lot of decongestion, sneezing, nosebleeds, and severe headaches.
And we found out that Dr. Worrell now has the allergist in his office, so when I spoke with him, he gave me time to go down and talk with the allergist, and then I started talking to him about my symptoms.
Typically, people will have allergies that show themselves in a similar pattern at the same time each year, if they're seasonally related. Sometimes environmental allergens will show themselves as part of their history in terms of if they're allergic to dust or if they're around dogs or cats. And so after we question the patient appropriately and do the appropriate exam, then we go ahead and if the patient is inclined to do so, send them down to our allergy lab here in the office.
I was given the allergy test, so I got about 50 needles in both arms and realized I'm really allergic to pollen and mold and ragweed, and that's why I was coming to Dr. Worrell so consistently and why I was not able to breathe and had these bad nosebleeds.
Questions are given to determine that they are good candidates for testing and desensitization, and then they proceed with a procedure that takes about 30 minutes. And during that time, the 48 top allergens in the area are tested on skin testing. The results are measured out and the determination is made whether they're a good candidate.
The first steps that we have to go through, I got to come in the first week and I have to get my first round of shots. And so I get a shot in my left and my right arm. So my first visit, the allergist gives me the shot. And then the second visit, I give myself the shot. Eventually, I'm just going to have to come into the doctor's office just to get my meds and then take them home and give myself my shots. And so I'm going to probably take these shots for about a year.
Usually within a few months, they'll be having significant relief of their allergies. And then we continue that on for as long as 2, maybe even 3 years.
My relationship with Dr. Worrell, first of all, I love him. He's definitely one that explains everything to you. He's really friendly, his staff is friendly. I really trust him when he tells me anything that's going on with me. I just can't see myself going anywhere else. I really enjoy coming to him.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
Lifeworks Group is, we like to say, a collaborative therapy group. So we work with all walks of life, all kinds of issues. We have plenty of therapists to cover, anything that you could come up with. What's nice about our group is that we're very holistic, so we work as a team. We share cases, and then on top of that, we add in yoga therapy. The way that it works is we really find that in actual, cognitive therapy with a therapist, it's all in your head, and you are discussing and knowing. It's the knowing of the issues that you have, but oftentimes we find that you can intellectually understand some of your issues and how to solve them. And it allows people to really feel their feelings and get them to really experience what's going on in their lives, what's going on in their bodies, and what's going on in their hearts.
Yoga therapy has been so important for me, especially with Petrie and Lifeworks. I think they've done a great job of having an open space and a place of healing. For me, it's been very centering for me, and especially in the mix of craziness in my life that I feel, I'm having to make the time for me to center, to be grounded, and every time I leave, I am more energized and feel like revitalized.
I have benefited from yoga in a number of ways. It is great for me mentally, physically, and spiritually. In the midst of busy, crazy life and 2 children, it gives me the time to focus inward on myself.
So just about any human being, I believe, can benefit from yoga therapy. I see adults for yoga therapy. I see families, and my most enormous passion right now is working with children. Yoga for children is incredibly beneficial because number one, it's just powerful for them and it's empowering. Yoga for kids is a little bit different because it's a collaborative effort. They get to participate and it's very creative. And we find that that's a really nice outlet for the kids after a therapy session to have yoga, let them be themselves for a little bit. So it's nice.
found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bid on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear. It gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
That will do it. That'll wrap up another edition of the Best Docs Network, which of course, Candace, features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
And for more information on those doctors, be sure to visit our website. It's bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We will see you next week.